Welcome back to the channel. I'm Dr. Carla, a pelvic floor physical therapist, and I'd like to talk to you today about constipation and how pelvic floor therapy can help. Constipation is multifactorial, can be related to diet, not enough water, not enough fiber. It can be related to medication side effects. There's many different factors. Another factor is the pelvic floor muscles, which are skeletal muscles, and it includes the external anal sphincter. Sometimes we have a lack of coordination or discoordination of those pelvic floor muscles, meaning that when we're having a bowel movement, those pelvic floor muscles need to soften, lengthen, and release so then we can have a bowel movement with ease. And sometimes those muscles are doing the reverse, they're tightening up. It can be something that can be treated with pelvic floor therapy. I'm going to present to you 3 strategies to help you begin your journey on improving your bowel movement mechanics. Number 1, when you're on the toilet, sit nice and tall so that you have your ribs lined over your pelvis, feet flat on the floor or supported on a support system. It could be a footstool, something like that. You just don't want the legs to dangle, nor do you want to lean excessively forward on the toilet. Again, nice and tall. Second thing, if you watched my other videos, I talk a lot about how important the breath work is to promote better coordination and better movement to the pelvic floor. Think of the pelvic floor as a hammock. And when we inhale, that hammock is going to soften, lengthen, and release. And so when we're getting ready to have a bowel movement, to minimize straining, which creates more downward pressure on that pelvic floor, which can cause those muscles to tighten up, which makes it more difficult to have a bowel movement. Do this. When you're sitting nice and tall on the toilet and getting ready to have a bowel movement, focus on, again, maintaining good posture. That makes it easier to have a bowel movement, a good anal rectal angle. Second is the breath work. Breathe in, and so that belly expands. And then exhale through the mouth. And as you're exhaling, you can give a little push to get the bowel movement started. The last is an exercise that you can do either on the floor, you can do it on your bed, your sofa, wherever you feel comfortable doing this exercise. And what you're going to do is lie down on your back. And if you're able to do this on the floor, have a little bit more room, but if not, no worries. You can do it on your bed or your sofa, bringing up one leg, both legs, and then a little bit of rocking back and forth, breathing in through the nose, nice big breath in and out the mouth. And the movement of our bodies, if you're not able to do that, walk, get up and move around. Those are 3 evidence-proven strategies, and I'll include a link to an article in the description below